CEN Practice Test video. Question 1. Which laboratory value is most specific for acute myocardial infarction? CEN-B, myoglobin, troponin I, BNP. Question 2. A patient with type 1 diabetes presents with vomiting, abdominal pain, and a serum glucose of 650 milligrams per deciliter. The nurse anticipates the following laboratory finding: respiratory alkalosis, metabolic alkalosis, metabolic acidosis, normal anion gap. Question 3. A patient presents with a swollen, bruised leg after a blunt injury. The nurse notes tense compartments, severe pain on passive stretch, and paresthesia. The nurse suspects deep vein thrombosis, compartment syndrome, cellulitis, rhabdomyolysis. Question 4. A patient presents with sudden onset pleuritic chest pain and shortness of breath after a long flight. The nurse's priority is to assess for myocardial infarction, pulmonary embolism, pneumothorax, asthma exacerbation. Question 5. A patient is brought to the ED after being struck by lightning. Which finding is most concerning? Confusion, unequal pupils, tachypnea, hypertension. Question 6. Which finding is most concerning in a patient with suspected right ventricular infarction? Hypotension, jugular venous distension, clear lung fields, ST elevation in lead 3 greater than lead 2. Question 7. A patient presents with hematemesis and melena. The nurse's priority is insert a nasogastric tube, administer oral vitamin K, establish 2 large-bore 4 lines, and administer fluids. Prepare the patient for an endoscopy. Question 8. A patient presents with altered mental status, fever, and a petechial rash. The nurse suspects viral meningitis, bacterial meningitis, encephalitis, anaphylaxis. Question 9. A patient develops a sudden, severe headache described as the worst headache of my life, along with nuchal rigidity and photophobia. The nurse suspects migraine headache, tension headache, subarachnoid hemorrhage, meningitis. Question 10. A patient with chest trauma is noted to have paradoxical chest wall movement and shortness of breath. The nurse suspects tension pneumothorax, simple pneumothorax, flail chest, cardiac tamponade. Question 11. A patient with a history of depression arrives after ingesting an unknown quantity of acetaminophen. The nurse anticipates activated charcoal, N-acetylcysteine, sodium bicarbonate, flumazenol. Question 12. The nurse is performing a secondary assessment on a trauma patient and notes a GCS of 12, a respiratory rate of 30, and an SpO2 of 89% on room air. The nurse should apply oxygen and prepare for intubation. Complete the secondary survey before intervening. Place the patient in a high Fowler's position. Administer naloxone. Question 13. A patient presents with severe, tearing abdominal pain, a pulsatile abdominal mass, and hypotension. The nurse suspects acute pancreatitis, ruptured abdominal aortic aneurysm, bowel obstruction, appendicitis. Question 14. A patient presents with a high-pressure paint gun injury to the hand. The nurse's priority is soaking the hand in warm saline, icing and elevating the extremity, preparing the patient for surgical exploration, administering a digital block. Question 15. Following blunt chest trauma, a patient has absent breath sounds on the left, tracheal deviation to the right, and hypotension. The nurse suspects massive hemothorax, tension pneumothorax, simple pneumothorax, cardiac tamponade. Question 16. A patient with a terminal illness requests a do not resuscitate order. The nurse's role is to encourage the patient to discuss this with their family, notify the physician, and support the patient's decision. Refuse to care for the patient. Contact the hospital ethics committee. Question 17. A patient with pelvic inflammatory disease is being discharged. Which statement indicates the patient understands the discharge instructions? Getting pregnant shouldn't be a problem once the infection goes away. I'll take the medicine for nausea when I feel sick to my stomach. I will be at increased risk for ectopic pregnancy. I will follow up with my doctor tomorrow. Question 18. During a cardiac arrest, the first dose of epinephrine should be given immediately after the first defibrillation attempt, after 2 minutes of CPR, before any defibrillation attempts, only after obtaining an advanced airway. Question 19. A patient with known borderline personality disorder presents with superficial wrist lacerations. The nurse's priority is providing emotional support, suturing the wounds, assessing for suicide intent, discharging the patient home. Question 20. A drowning victim is brought to the ED. The major physiological insult is hypothermia, pneumonia, hypoxia, dysrhythmia.